Doctors agree. After age 70, these 6 body parts age dramatically, but if you notice these 6 facial signs, you're aging slowly and likely to live longer. Have you ever noticed how once people pass the age of 70, it seems like they suddenly start aging at lightning speed? One day, your neighbor was perfectly fine buying groceries on their own, climbing stairs, tidying the house without a sweat. The next day, they're short of breath after just a few steps, complaining of fatigue, memory lapses, or even loose teeth. It feels like the body just throws in the towel overnight. Doctors say this isn't just in your head. It's a real, almost cliff-like acceleration in aging that hits hard once you cross the 70-year mark. Think of 70 as a critical tipping point in your body's timeline, where 6 key parts of your body start quietly declining. But here's the fascinating twist. Your face actually holds clues that can predict if you're aging slowly or quickly. If you have at least half of these positive facial signs, you might very well live 10 years longer than your peers. Let's break this down piece by piece. 1. The cliff. Why after 70, aging seems to hit like a wall, and which 3 diseases are the biggest threats? Many seniors notice a sharp change after 70. The spry grandma who did Tai Chi in the park every morning now walks slower, struggles to balance, and spends more time in and out of the hospital. This isn't a coincidence or bad luck. It's biological. Researchers at the University of Cambridge published a study in the journal Nature that sheds light on what's going on inside the body. They found that after 70, the pool of hematopoietic stem cells, these are the blood-forming cells in your bone marrow, shrinks dramatically. Instead of hundreds of stem cells producing new blood cells, only a small group of about 10 to 20 cells keep things going. These remaining cells accumulate mutations over the years, which impairs the immune system, ramps up inflammation, and speeds up aging. A similar large-scale epidemiological study tracking nearly 100,000 seniors across 10 regions in the U.S. confirmed that 3 diseases cause the most deaths after 70. 1. Cardiovascular disease. This silent killer tops the list. Conditions like high blood pressure, coronary artery disease, arrhythmias, and heart attacks are often the result of aging blood vessels. As arteries harden and lose elasticity, and with complications from cholesterol and blood sugar levels, your heart is left vulnerable to sudden events like heart attacks or strokes, which can cause sudden death. In fact, cardiovascular events contribute to over 45% of deaths in seniors. 2. Cancer. As you age, your cells lose their ability to repair themselves, and the chances of genetic mutations increase. This means cancers like lung, liver, stomach, and pancreatic cancers become far more common and aggressive. The elderly often have weaker bodies that tolerate treatments poorly, so a cancer diagnosis after 70 is particularly serious. 3. Respiratory diseases. Chronic coughs or shortness of breath might seem minor, but they often hide serious conditions like chronic obstructive pulmonary disease, COPD, emphysema, or pulmonary fibrosis. With weakened lungs, years of smoking or pollution exposure, and recurrent infections, a respiratory crisis can come on rapidly, leading to respiratory failure. So no, 70 isn't just getting old slowly. It's often when the body's health takes a steep downturn. Without lifestyle changes, the risk of being felled by disease skyrockets. 2. The 6 body parts that quietly start aging after 70 and what to watch for. Aging is rarely a sudden switch like turning a light on or off. It's a creeping process that often starts in some parts of the body before others. After 70, 6 areas tend to show the earliest signs of decline. If you notice these, it's a signal to take action. 1. The head. Your head gives the first, most obvious clues. Deeper wrinkles, a receding hairline, thinning hair, enlarged pores, and worsening eyesight. Changes in the forehead width and nose shape often reflect skin sagging and bone density loss. If your hair feels thinner, your scalp more visible, and you're squinting more, these are the subtle signs of overall bodily aging. 2. The mouth and teeth. Dental health is often overlooked, but crucial. After 70, gums tend to shrink, teeth loosen, and sensitivity or pain from decay or gum disease increases. A dulling sense of taste makes eating less enjoyable, which can lead to poor nutrition and even digestive issues. You might notice difficulty chewing or swallowing, which can impact your overall health far beyond just your smile. 3. Your blood vessels. The body's silent killer is clogged or stiff blood vessels. After 70, reduced vascular elasticity sets the stage for high blood pressure, arterial hardening, and strokes. Many seniors complain of fatigue after short walks, but it's often their blood vessels, not their heart or lungs, that are struggling the most. 4. The heart. Unlike pain in joints or muscles, heart problems often go unnoticed until severe. Shortness of breath climbing stairs, irregular or rapid heartbeat, or chest tightness are red flags. These symptoms often signal worsening heart function and require prompt attention. 5. The digestive system. The gut slows down with age. Reduced stomach motility means food lingers longer, while slower bowel movements can cause constipation. Many elderly find greasy foods harder to digest, leading to discomfort and reduced appetite, all of which undermine nutrient absorption and delay body repair. 6. The legs. Legs tell the story of mobility. Aching joints, weak knees, and difficulty descending stairs show that lower body muscles and joints are losing strength. When leg function declines, daily activities reduce, which speeds up overall aging. 3. How to slow the aging of these 6 key areas, simple daily habits that really work. While aging is inevitable, you can slow it down by adopting small but consistent habits. Here are some practical, research-backed tips to keep those 6 body parts healthier for longer. 1. Brush your teeth twice a day and see your dentist regularly. Poor oral health affects much more than your smile. Studies show that gum disease and tooth loss link to heart problems and cognitive decline. Seniors especially need to preserve chewing ability to maintain nutrition. Regular cleanings and good brushing habits help stave off gum disease and keep your teeth in place. 2. Take a 30-minute walk after meals. Don't underestimate this simple habit. A gentle post-meal stroll aids digestion, stabilizes blood sugar and cholesterol levels, and supports vascular health. Strong blood vessels ease the heart's workload and reduce the risk of cardiovascular disease. 3. Get 15 minutes of sunlight daily. Vitamin D from sunlight is crucial for calcium absorption and bone strength. The best times are before 9 a.m. or after 4 p.m. Strong bones support joint health and leg stability, helping maintain mobility. 4. Soak your feet for 10 minutes before bed. Foot baths improve blood circulation in the legs, relax nerves, and relieve fatigue. Better circulation also supports gut function and can improve sleep quality. 5. Massage your scalp for 3 minutes twice daily. Healthy scalp circulation benefits hair follicles and brain function. Use your fingertips to gently massage from the forehead to the back of your head, helping reduce hair loss and slow aging signs. 6. Stay hydrated, eat enough protein, and prioritize sleep. These are classic, often overlooked basics. Protein supports muscle, immune, and heart health, all vital in old age. Hydration keeps organs functioning smoothly, and good sleep gives your body time to repair. 4. 6 facial features linked to longevity. What your face says about your health. According to Dr. Robert Green, Chief of Hepatology at the University Medical Center in Boston, facial characteristics can provide surprising insights into overall health, not just appearances. This isn't superstition, but clinical observation. Here are 6 features often found in long-lived people. 1. A full face and strong teeth. Many believe tooth loss is normal with age, but losing too many teeth affects speech, digestion, and even gut health. Seniors should ideally keep at least 20 healthy teeth past 80 to maintain nutrition and vitality. 2. Bright, clear eyes. Eyes that are sharp and full of life help seniors stay more alert, coordinate movement better, and avoid falls. Cloudy whites or dull eyes often signal poor health and higher risks. 3. Rosy, moist lips. Red, plump lips indicate good hydration and circulation. Dry, cracked, or crooked lips could warn of dehydration, stroke risk, or poor blood flow. As the old saying goes, a lively mouth means a long life because it reflects eating habits and social interaction. 4. Thick, well-groomed eyebrows. Though it sounds old-fashioned, thick, dark eyebrows generally indicate good blood flow and vitality. Sudden thinning or widening may reflect organ function decline or poor circulation. 5. A neck that's not too thick. Studies show that a thicker neck circumference correlates with higher cardiovascular risks. Men with necks larger than 15.5 inches or women above 13.7 inches should be cautious. 6. A youthful, resilient face. A study published in the British Medical Journal highlighted that people who look younger than their actual age tend to live longer. Their faces reflect slower aging processes. 5. Meet Jim, a story of aging well after 70. Jim turned 74 last year. He still mows his own lawn, cycles every Saturday morning, and walks his dog every evening. His secret? He watches his salt intake, gets regular checkups, and never misses his morning walk or his evening glass of warm water with lemon. His doctor says his cholesterol and blood pressure are better than many 50-year-olds. Jim may have wrinkles, but his gait is strong, his posture upright, and his mind sharp. Age is just a number, Jim says, but habits are the real clock. Final thoughts. Turning 70 doesn't mean giving up. It's a time to level up your self-care. Watch those 6 body parts closely. Pay attention to the quiet signs. And let your face, that honest mirror, give you feedback on how well you're aging. If you spot the signs of vitality, cherish them. If you spot signs of decline, don't panic. Start with the simple habits we've laid out. It's never too late to age gracefully, and even more importantly, to live fully.